What do we want? Where do we want them? Now!
Today we stand united asking for what is just and what is fair.
We have made it abundantly clear to management that the staff workloads are unsustainable. We've witnessed many of our experienced colleagues leave over the last 3 years.
Nobody is listening. In 6 weeks, there's still no movement from SVHA. There's still no draft EBA as promised. They're not even meeting their own deadlines that they're setting for themselves.
Ratios is not an unreasonable request. It's a necessity to deliver safe and reasonable care to your patients, to your community. St Vincent's Private are yet to work this out, but your action today will demonstrate that anything less than a fair pay rise and ratios is simply not good enough.
No more talk fest, we want you to act.
We're treading water every day, making decisions as to who needs our help the most first, and people are getting burnt out.
Exhausted, struggling to cope, let down, dangerous, overwhelmed. These are some of the words nurses have expressed about their shifts at St Vincent Private in recent times.
In July last year, St Vincent's Mater Health has engaged with us to finalise our enterprise agreement. Since then, they have repeatedly stalled.
Like nurses and midwives across the state, we are incredibly understaffed, so we're under constant pressure at work. We're regularly missing breaks, we're staying back late, we're coming in early, we're picking up overtime shifts, and junior staff are being left in charge of the wards with no senior support.
It's quite simple. You look after us, and we look after you.
One nurse told me 56 hours in the last pay. 56 hours of overtime. That's a full FTE for that week, right? It is an abuse by your employer to knowingly do that to you. To know that you are working short shift after shift and expecting you to take a pay that is buying you less and less day after day. If they have a business model that relies on that, then it is not a business model. It is an exploitation model, and it has to stop.
We are dealing with one nurse to every 6 to 7 patients during the day, 1 to 10 at night, with no supporting junior doctors, regis or team, but just one RMO for over 220 patients for support, and that is every day.
Safe ratios are paramount. They need to be enforced.
It is unacceptable that we've been offered so little for the life-saving work we do every day. We deserve a fair wage, one that reflects the value of the work we do, and something greater than 3.75%.
It is extremely important that we fight and that we get ratios that are reflected by the ACORN standards.
I could do my job really well, my patient would get good care, and I can go home at the end of the day knowing that I've done well. Ultimately, the patients are getting the care that they need and deserve.
We are here to stay. We're not going anywhere. The theatre staff stand with the wards, and we stand together.
We will stand on the streets and we will demand what needs to be applied, and that's ratios and a decent pay rise.